Family planning is a very important component in the healthcare system. As you know, Gombe State being part of the Northeast, we contribute a high percentage of the maternal mortality and infant mortality across the country. In the Northeast, generally, maternal and infant mortality is higher than the national average, according to the NDHS survey of 2018. And one of the best ways to reduce maternal and infant mortality is through family planning, or child spacing, as we call it. So we take it as a very important aspect in our healthcare system. A lot has changed. I can say that in the past, we have seen an improvement in budgetary allocation to family planning. In the past, we do not even have a budget line for family planning. But now we've seen a budget line being created for family planning, and then improvement in allocation over time, and then improvement in releases. And one peculiar thing about the type of partnership we have with TCI is they provide catalytic funds, and we also at the state provide matching funds. And we've seen a lot of improvement in the areas of leadership and coordination, and other aspects like data reporting, and also community engagement on child spacing with religious leaders as well as traditional leaders. We've seen an improvement in leadership and coordination, just like I've mentioned. We have seen our technical working groups, monitoring and evaluation, leadership and coordination, and social mobilization working group have been strengthened. We do conduct meetings regularly to discuss issues and challenges that has to do with child spacing in Gombe. And we've seen a lot of coordination with other partners that also provide support in the areas of family planning. So overall, there's an improvement in how work plans are being implemented. Now they are implemented efficiently, and we see how we can use the little resources we have to optimize service delivery of the facility, meaning there are no more duplication in child spacing delivery in the facility. First of all, TCI came to the state about 3 years ago. We provided an office space for them, so they are embedded within the agency with our staff. So there's a lot of learning, coaching, and mentoring that has taken place, a transfer of knowledge between TCI and our staff, and that informed a lot of ownership. And now that we are transiting into graduation phase, I'm sure most of those learnings will be sustained over time, even after TCI has left state. And we've seen a lot of community engagement activities. We've seen how religious leaders and traditional leaders have taken interest a lot into child spacing. We have seen a lot of coordination between the facilities and then the community, and this has improved accessibility to family planning. With TCI, we've seen a strengthened partnership, not just in family planning, but in other services, antenatal care, immunization, even skilled birth delivery, because some of the services are implemented in an integrated fashion. So that has impacted the way those services are delivered during, for example, during outreach services. And for the type of partnership we had with TCI, whereby we had to kind of express interest before they came into the state, we've also learned from that, because another partner, that was what happened. The government, right, an expression of interest, that is the impact project. And the impact project now is in the state, and it's mainly as a result of the type of partnership we had prior to the impact with TCI. So it has impacted a lot in the state. We now have a budget line for family planning, and it has been consistent. We have a strengthened leadership and coordination platform, where there are different technical working groups which we meet regularly. We have also partner coordination forum, which we also meet quarterly. So this leadership and coordination platform is a very important avenue for us to sustain most of those interventions and investments in family planning. So we've seen an improvement in our data reporting from our private facilities and also from the public facilities. Seen improvement in reporting at the state level, at the local government level, at the facility level. And then we have seen and strengthened SPCC working group, whereby there is a lot of advocacy, sensitization across community, and this has improved demand for family planning. And we've seen a lot of capacity being built in our state among our staff. And that is why the state is among some of the few states that use state resources to procure family planning commodities. And this, to some extent, has reduced out-of-stock family planning commodities in our facilities. There are national guidelines for the promotion of family planning commodities, and through the support of TCI, we adopted these guidelines. And after the adoption, we took on the bull by the horn, and we started procuring family planning commodities through UNFPA. And that, just like I've said, has improved availability of family planning commodities in our facilities and reducing unmet needs for family planning. We have a partner coordination forum, which meets quarterly to review our work plans and also to monitor implementation. And ab initio, before even the work plan, we meet with all our partners, including TCI, to harmonize the work plan and to see areas where there are duplication activities to streamline them. And then we meet on a quarterly basis to monitor these activities. Apart from that, we have technical working groups, leadership and coordination, data management, SBCC working groups. These are all coordination platforms where all of these activities are being tracked. I would like to commend TCI because a lot has been gained. A lot of knowledge has been transferred to the state, and a lot of high-impact interventions. And these high-impact interventions are very easy and cheap, and will be very easy for the state to sustain. And there's a lot of ownership. And then the model of the partnership, which I stated earlier, TCI are domiciled in our office, and a lot of knowledge and skills has been transferred to our staff. So that is quite an achievement for us.